Good evening to everyone and welcome to today's session. Karnik and prescription to PG, Pradeep Reddy, Yugender, Republic, Dhanalakshmi and many more who are all online. So 10 more days we are out of this lockdown. It's all our perception. If we feel locked down, even doing a night duty also looks like a lockdown. Whereas the entire night, you are taking a CSF sample, you are taking a cytic fluid sample, you are doing an intubation of somebody, managing somebody on ventilator. The night duty, we don't know how the night has passed. So it is all that relativity at which we look at the workplace, the ecosystem, environment, and our life. The outlook is everything, doctor. So let's make the great beginning every day across the year. COVID or no COVID, epidemic or pandemic or earthquake, we will continue to prepare every day together. That is a promise. 34-year-old presents with cutaneous hypopigmented lesions. These lesions are concentrated on the extremities and the buttocks. The patient has madarosis, loss of eyebrows, epistaxis. The past medical history is positive for the childhood asthma and atopic dermatitis. So looking at these lesions, presence of madarosis, it is lepromatous leprosy. So if you administer which cytokine, is it going to improve the patient's condition? Is a very important question. Interferon gamma. So in this clinical example, what you are seeing is the CD4 helper T cells undergo differentiation into Th1 and Th2 phenotype. The Th1 cells, they drive a cell-mediated immune response that include activation of the macrophages and cytotoxic T lymphocytes. Whereas Th2, typically, they mediate a antibody-mediated response. So because Mycobacterium leprae is a intracellular pathogen that goes and directly infects the macrophage. Mycobacterium is such a robber, it directly goes and robs the police station itself. So you need to, in order to control the leprosy, Mycobacterium, you need to basically make the police system, cell-mediated immunity stronger. So who controls the cell-mediated immunity, doctor? It is the Th1 cells that control the cell-mediated immunity. So you need to enable the differentiation of the Th cells more and more into Th1 response. So how can you do that? It is the interferon gamma, which is produced by the Th1 cells, which is very important role to activate the macrophages. So that is the reason, if you happen to give interferon gamma, then though the Th1 cells are not available, still you can be able to activate the macrophages. That is the logic behind giving the interferon gamma to make the cell-mediated immunity, the macrophages become stronger is what you need to remember. So doctor, USMLE, step 1, anatomy, physiology, biochemistry, microbiology, pathology, then immunology, behavioral science. These are all logically driven questions. They go into the depth of the pathophysiology, application of the concepts. Today, all licensing exams across the world are all clinically oriented, problem-based learning and image-based questions. So that is the reason you need to do more and more practice. Then you will understand what is the logic behind these questions. So every day around 50 to 60 questions of both USMLE Step 1 and USMLE Step 2 CK, clinical knowledge, where medicine, surgery, gynecology, obstetrics, pediatrics, family medicine and psychiatry, dermatology, radiology. So we are going to do the discussion. So totally around 10,000 clinical vignette image-based questions in about 400 hours, 200 hours of Step 1, 200 hours of Step 2. We are going to have the discussion over the next 100 days, 100 to 120 days, next 4 months. So that is the reason, take every opportunity to be part of online MBBS.com video library. Subscribe to the online MBBS.com video library. After this class is over, we upload these PowerPoints, questions, quizzes, and the videos, everything into the online MBBS.com video library under the USMLE folder. Okay? Now, a 53-year-old woman complains of back pain that is dull, constant. Whatever be her activity, it is dull, constant pain. Classical story. Elevated serum alkaline phosphatase levels. Now, what you are able to see are, here there is a metastasis, 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 metastasis. Multiple metastatic lesions to the vertebrae you are able to see in this MRI. So, metastatic carcinoma to the spine. What is the most common source of it, doctor? Breast cancer, lung cancer, thyroid, testis, kidney, prostate. So typically if you look at the bone, the most common tumor of the bone is not the primary bone tumor. Metastatic lesions to the bone are more common than the primary bone tumors. That is what you need to appreciate. A 23-year-old woman, painful, swollen left elbow, there is also fever. And also her right knee is swollen and slightly painful. Keep punching some points that come to your mind, something that you studied in the morning or some cases that you have seen similar to the clinical vignette. Keep punching. Keep the discussion moving on in the chat window, doctor. So a live discussion is of two kinds. We can put up a Zoom and then get all your cameras on and then we deliver a class. But that is a big noise. Whereas you are interacting on the YouTube chat very vibrantly and teacher alone is speaking, that is a very easy thing, best thing, most effective thing and a proactive thing. Even today when we conduct the face-to-face live classes, when hundreds of students sit there, we are encouraging them to keep texting so that is a very effective way to talk to the presenter and to the teacher and make the session interactive. So that is the reason, doctor. Life is all being interactive, most important. When you go to the hospital also, nobody will come and hold your hand and show you, hey Ramu, this is multiple myeloma. Hey Ramu, this is TB. Nobody will do that, doctor. It's wrong to expect that from the teachers. Rather, you go and sit with the patient. You talk to him. Hey man, what's the problem? Since how long you are having this? How did it start? Before that, what were you doing? Do you have a pain? If so, where is the pain? When is the pain coming? And how frequently is it coming? Is it a lancinating pain? As you build a conversation with the patient is the best teacher. He's like Harrison, Davidson, Bailey, Lau. Everything will come out of that patient to you. He's like a reincarnation Like Dalai Lama is a reincarnation of Lord Buddha. Like that. Patient is the God. He will tell you the entire story. And listening to the story is most key factor, doctor. For that, as a medical student, what is most important? Being communicative, to talk. Being medical student, empathy. Empathy to the humankind, to somebody's pain. You are born, you are wearing an apron to identify the cause of the pain of a person and then resolve it after shooting a right clinical diagnosis. Right, doctor? So start practicing it that every day without talking to at least 4 to 5 patients, don't go to sleep. That is the only way you will become a topper, a high percentile score winner. Every opportunity available. You try to talk and listen to the patient's story. That's the best way to learn the clinical medicine, doctor. Now, this patient, anti-dsDNA is negative, but the Smith nuclear antigen is positive. Anti-nuclear ANA is positive. VDRL is also positive. She's very angry with you, your patient. No, I'm not sexually active. How can I be VDRL positive? There is also malar rash. So all this will talk about the SLE as your diagnosis, systemic lupus erythematosus. The antiphospholipid antibodies which are there in her serum will create a false positive VDRL testing. Though she doesn't have syphilis, VDRL will be false positive is what you need to remember. So what is the famous mnemonic about SLE? You go to any USMLE forum, everyone talk about it. Brain soap, MD. Brain soap, MD. I know. I don't know which moron has thought about it. Generally, mnemonics are better thought by those who have a challenge to remember. So that is the reason. The more the moron the guy who frames the mnemonic, the more easier it is to remember that. Right? Now, blood dyscrasias, B, hemolytic anemia, thrombocytopenias, R, renal disorder, there's a renal dysfunction, SLE. Arthritis, 2 or more peripheral joints. Immunological, that is anti-DNA antibody, anti-Smith antibody, they're all positive. Neurological disorder, serositis, pleuritis, pericarditis, pericardial effusion, pleural effusion, oral ulcers, anti-nuclear antibody, elevated titers. The only thing is, in drug-induced lupus, you don't have, you should look for specific antibodies of drug-induced lupus. Photosensitivity, malar rash, discoid rash, they're all the characteristic features. A 34-year-old man presents with a red, itchy eye. There are genital lesions, ulcerations. There is also pain on urination, diffuse joint pain. But he tested negative for gonorrhea, for chlamydia. He is also negative for rheumatoid factor. And he has HLA-B27 positive. So HLA-B27 is classically the HLA marker of seronegative spondyloarthropathy is what you need to remember. Seronegative spondyloarthropathy. Seronegative means, typically if you do the serological analysis for rheumatoid factor positivity, they will be negative. Spondyloarthropathy, typically the spine is involved. The joints of the spine are involved. Typically it involves a lumbosacral spine. That's the reason lower back pain is a presenting feature of Spondyloarthropathy. He had a history of diarrhea 2 months ago. So, after the infection, all his body is reacting. That's called reactive arthritis. He can't pee. He can't pee. Pee means he can't urinate. He can't see. See means he has conjunctivitis. Some people have uveitis also. He can't climb. He can't climb because he has got arthritis. He can't see, he can't pee, he can't climb. That is a case of Rheumatoid disease. As Pradeep Reddy rightly says, always rightly says, keratoderma blemorrhagica is typically positive in these individuals, is what you need to remember. So typically, urethritis, arthritis for at least 1 month. And most patients are between 20 to 30, 80% are positive for HLA-B27 is what you need to remember. So doctor, what you need to do is, once more, I keep telling you every day, probably I am trying to advertise you to invite you to join the online MBBS.com video library. Right? So, how do you make the best use? So, somebody throws videos on you in the mobile app or etc., etc. It is like any book. You won't be motivated to study. But with onlinembbs.com, we are not like that. We don't throw a mobile app or a video library on you and ask you, hey, come on, read. No, that's not our way. We stimulate you every day with a live online interactive session and invite you to pick up 3 to 4 topics every day. So once you come to the onlinembbs.com, you have 650 high-yield topics review, 30,000 hot MCQs, which are available along with discussion, PowerPoints, quizzes, everything. You have got the mock tests every week. Only because our staff is not available, we could not be able to conduct this Sunday and next Sunday mock test. Maybe next Sunday onwards, we once more restart the mock test. Then, and also discussion. Then, whatever that we are discussing here, you have the theory revision, MCQ revision video lectures. They're all available for MBBS final year, third year, first year, etc. Second year on the onlinembbs.com. Then whatever now we are discussing here, it will come to the USMLE Step 1 coaching. Here all these videos get uploaded. You get unlimited access to all this entire video library. And also every Sunday, once this lockdown is over, probably after 14th, we'll restart. From April 14th, after that, we will restart every Sunday for the final MBBS students. Morning 9:30 to 5:30, we have a day-long discussion and then we complete one major chapter. Medicine, surgery, gynecology, obstetrics, pediatrics, orthopedics. This is what we discuss on every Sunday. And that also become live broadcasted, no worries. So doctor, what I want to tell you is, many people ask me a question, what is the secret for winning any exam? The secret of winning is perseverance. That is, persistently preparing. Then the secret of winning is clarity in concepts, not mugging. Clarity. You need to have logical clarity. The secret of winning is not about reading extensively. Every topic you should have 10 to 12 points in your hold. If I scratch you, you should talk 10 to 12 points. If I scratch you about streptococcus, you should tell 12 points or 15 points. If I scratch you about SLE, you should talk about 15 points. Like that, all the 953 topics, high yield topics from 19 subjects that we have created. If you don't have the subject topic list, please come to the onlinembbs.com video library. So when you come to the onlinembbs.com, here you have a form. There is a form available for you to fill. So please fill your mobile phone number, email ID, name and place, and then you also download a PDF, and our people will reach out to you and then provide you the PDF. Okay, doctor? So that is very, very important. Now, doctor, which activity will be adversely affected if the lateral pterygoid muscle is affected? All the muscles of mastication. Favorite question of the examiner. Whether you go to America, Philippines, Sri Lanka, Bangladesh or India, any entrance exam, favorite question. It makes you to yawn. When you yawn, you open the mouth. To open the mouth, lateral pterygoid is required. So lateral pterygoid, masseter, temporalis, medial pterygoid. These are all the muscles which are involved in the movement of the jaw. All the four of them are innervated by the trigeminal. Only lateral pterygoid opens the mouth. All the other three, masseter, temporalis, medial pterygoid, they close the mouth. So what is a eminent mnemonic to remember this? Lateral lowers the jaw. Lateral lowers the jaw. That means you open the mouth like in yawning. Yum's munch. That is yum for masseter, yum for medial pterygoid. They make you to munch. Close the jaw. That's what you need to remember. Wonderful. Very good to see 47 online students, doctor. Excellent. Please invite some more of your friends. Every day, my dream is to see 300 or 400 of you to join this session. Please bring your friends also. And also please drop this www.onlinembbs.com. Please give a referral to your friends. Hey, this is a nice place. There is unemployed MD General Medicine, Dr. Murali Bharadwaj, available for you anytime, any part of the day to discuss the subject, right? So please do promote it. A 46-year-old woman comes with a blurry vision. She says that, hey, my eyes are very dry, doctor. That means she is not having lacrimation. She is unable to make any tears. Even if her mother-in-law dies also, she doesn't get tears. She also states that there is a very dry mouth in spite of drinking fluids. That means her sublingual salivary glands are also not working. Then she has ulcerated cornea. Obviously, if your eyes are very dry, there is no lubrication, there is an ulceration. Her tongue is showing a lot of fissures. Obviously, when your tongue is very dry, it becomes fissured. Both her knees are erythematous. They are swollen, and she gives a history of morning stiffness. That means she is having arthritis. She is rheumatoid factor positive and also anti-SSB positive is what you need to remember. Very good. Pradeep adds a very good point. SSA is associated with, it is also called anti-Rho antibody, is associated with congenital heart block. If the mother is having SLE, the baby will have congenital heart block. So considering all this, what is your diagnosis, doctor? Sjogren's. Typically, Sjogren's is like a rheumatoid arthritis. Rheumatoid arthritis involves joints, kidney. Even Sjogren's also involves joints and kidney. Additionally, Sjogren's, there is a lymphocytic infiltration into the exocrine gland like lacrimal gland, salivary gland, and there's a destruction of the salivary and lacrimal gland. Lacrimal gland destruction lead to dryness of the eye, no tears. Schremer's test, you will put one strip and see whether tears are there or not. Schremer's test, okay, is typically positive to show that absence of tears. Similarly, sublingual gland, you can do a biopsy. And if you look through microscope, you will find all that lymphocytic destruction of the salivary gland. Lymphocytic infiltration and destruction, which is responsible for the dry mouth. So that is the story of Sjogren, which is called keratoconjunctivitis sicca, is what you need to remember. What is the common age group, doctor? Between 35 and 45 years. Now, a 46-year-old woman, she has increasing pain and swelling in the joints of her hands, her feet, and microscopically you have checked it. Say, this is the normal synovium, doctor. So what do you have in this synovium? What are you able to see? Lot of inflammatory cells. All this dot are there. No? They're all the inflammatory infiltrates that have invaded her synovium. Histologically is what you need to remember. Now, a microscopic image of her synovium is being shown. So what is the most likely possibility in her given case? Typically, she is a case of rheumatoid arthritis with synovial destruction. So obviously, IG, what is rheumatoid factor, doctor? After all, what is rheumatoid factor? It is a IgM antibody against IgG. IgG itself is an antibody. But what is rheumatoid factor? Rheumatoid factor is the IgM, which is against the IgG antibody, anti-IgG antibody, which is of the IgM type. That is rheumatoid factor. How will you remember? All men are behind girls. In there is one Tyagaraja Kruti. Enta nerchina, enta varalaina, Kanta Dasule. So, however learnt, however knowledgeable, ultimately men are behind the race of women. That's what Tyagaraja Kruti is being sung. So, men are behind girls, you can remember, is the rheumatoid factor. So, 80% of the patients with rheumatoid arthritis, they have positive rheumatoid factor, which is an anti-IgG antibody, is what you need to remember. 36-year-old man recently returned from a trip from Singapore. Oh my God, Singapore, Beijing, China, we are all afraid nowadays. So, Singapore. He also has fever, chills, weakness, enlarged lymph nodes. There is a painful ulcer surrounded by dark hemorrhagic purpura on the right arm, where these axillary lymph nodes are draining. So, we are talking about Yersinia pestis, which is responsible for the plague, the Black Death. The bacteria is being spread by fleas. There's a 2 to 8 days of incubation period. Exquisitely tender lymph nodes called bullous. Unlike the anthrax also has this bullous, but the skin ulcers seen in Yersinia pestis are typically painful, is what you need to remember. Now you have been shown a diagram, cross section. A is epidermis, B is dermis. Right, doctor? So you should know all the layers of the skin, basically. So, autoantibodies against which of these layers will be found in pemphigus vulgaris is a very important question. It is the antibodies against the epidermis. Epidermis, dermis. Here you have stratum corneum, granular cell layer, spinous cell layer, basal cell layer. These are the sebaceous glands, erectropylae, electropylae muscle. So you should know this cross section very clearly, doctor. So pemphigus vulgaris is autoimmune disorder. Where are the antibodies directed, doctor? The cell-cell adhesion protein between one cell and other cell. You have desmoglin 3. Antibodies are directed against a cell-cell adhesion protein, desmoglin 3, which is expressed by the keratinocytes of the epidermis, is what you need to remember. And the destruction of this desmoglin leads to intraepidermal acantholysis, but there is a sparing of the basal layer. So that is the reason if you apply the pressure, the overlying epidermis will get separated. So that is called Nikolsky's sign positive. And how will be those bullae? The bullae will be flaccid epidermal bullae if it is pemphigus vulgaris. But there will be tense bullae if it is bullous pemphigoid. That is a fundamental difference between the two. Once more, there is a very extensive discussion in the dermatology on the online MBBS.com video library. If you go back to that, you can be able to see more deeper, extensive discussion on all the bullous disorders, pemphigus vulgaris, epidermolysis bullosa, bullous pemphigoid. How do you differentiate one from the other? Histologically, how do they look like? Immunofluorescence, how does it look like? Everything is there on the online MBBS.com video library, doctor. After this session is over, you should pick up 4 or 5 topics and then go back to discussion. That's how you should be inspired. 8-year-old boy presents with fever, malaise, nausea, decreased urine output, smoky brown urine. It began 14 days. And he had recovered from a sore throat. So what is the most likely pathological finding? So there are 2 types of scenarios of hematuria, doctor. One is called synpharyngitic hematuria. Today I have sore throat, tomorrow I have a red colored, dark colored urine. That's called synpharyngitic hematuria. Synpharyngitic hematuria is typically the nature of IgA nephropathy. Generally, it will be benign recurrent hematuria and self-limiting in nature. Whereas, after 2 weeks, where patient didn't even remember about that sore throat, if the hematuria appear, then that is post-streptococcal glomerulonephritis associated hematuria. Glomerulonephritis, post-streptococcal, typically is an immune complex mediated condition. That's the reason the complement levels will be low. But what is the nature of complement levels of low complement levels of the post-streptococcal glomerulonephritis? What is the important rule you should remember? Acutely, when you see a case of PSGN, post-streptococcal glomerulonephritis, there is hypocomplementemia. But after 4 to 6 weeks, once more this hypocomplementemia is supposed to return normal. If it doesn't return normal, then it is not PSGN. Gotcha? If the complement levels do not normalize at the end of the 4th to 6th week, then it is not PSGN. That is a very important rule you should remember. Once more, please go back to the online MBBS.com video library. In the pathology, you have the topic of the PSGN and all types of glomerulonephritis. Have an extensive review. Right, doc? Now, enlarged. So how will be the typical morphology of the PSGN when you look through microscope? Hypercellular glomeruli on light microscopy, and dense humps are found on the epithelial side of the glomerular basement membrane if you do electron microscopy. So that is a classical feature which you need to remember. A 32-year-old woman presents with a diffuse red rash. Most of the body, except the palms of her hands and soles of her feet. She has fever, tachycardia, elevated respiratory rate, orthostatic hypotension. And but there are no signs of infection. There is no signs of infection. In fact, that is the 4th day of her menstrual cycle. Recently, she traveled to a remote tribal village in the hills for a geographic expedition. Because a lot of times she was outdoors, she doesn't want to use those public toilets. So she used a tampon and retained that vaginal tampon. So given all this history, what is your diagnosis, doctor? It is classically a case of staphylococcal toxic shock syndrome, which is caused by the exotoxin of the staphylococcus, is what you need to remember. Now, a otherwise healthy infant boy, what is this called, doctor? Porter tip position, because of the Erb's palsy. Okay, Porter tips position. So how do you describe Porter tips position? Pronated, medially rotated. Pronated. Prone means you are pressing. Supine means you are taking soup. If the palm is looking to the top, that is supine. This is prone. Pronated, adducted, more closer to the trunk. Right? So that is the typical position. So which muscle is still functioning in this case? Triceps is still functioning, but supraspinatus, infraspinatus, deltoid, biceps, all of them are affected. So this question is expecting you to know about the root value of these muscles. From where do the nerves supplying these muscles are originating. So typically Erb's palsy is C566 roots in the brachial plexus, superior trunk. Abductors, lateral rotators and biceps are the ones which are paralyzed. Abductors are paralyzed. That is the reason he is in an adducted position. Lateral rotators are paralyzed. So there is a medial rotation. Biceps is paralyzed. That is the reason flexion of elbow is affected. So it is extended. And only triceps is not involved, because triceps is innervated by the radial nerve, which is supplied by C6 to C8. But what is affected in the case of the Erb's palsy, doctor? It is the C5, C6 roots which are basically affected. So this is the great Erber and this is the Duquesne de Boulogne. And the nerves are basically damaged, leading to waiter tip position. So both of them are on a candlelit dinner and decided, hey, the same position that baby in the hospital also had. So that's how they got the claim of Erb's Duquesne's palsy. A 14-year-old boy presenting with complaints of muscle weakness, which is affecting the ability to play his football team. Even his maternal uncle, Mama, also became wheel-bound state by the age of 35 years. So what is the etiology of this disorder? So first of all, what is this, doctor? This is the pseudo-hypertrophy of the calf, which is typically seen in the case of the Duchenne's muscular dystrophy. which is transmitted as an X-linked recessive disorder. That is the reason his maternal uncle is also affected, is what you have to basically remember. Very good to see 50 online students. Come on, everybody give a big clap. Please ask your friends to join. Every day we will have a session. Imagine 50 to 60 questions we discuss like this every day. Within another 5 to 6 months, we will be ending up in discussing around 10,000 questions, image-based, clinical vignette-based, USMLE, step 1, step 2 CK styled questions. And the kind of confidence you will have to go and attack the examiner, whatever exam you are taking, any licensing exam, doesn't matter. So what is the secret of becoming a topper doctor? East or West, who is the best? Dr. Murli Bharadwaj sir is the best. Am I right? So onlinembbs.com is the best. So you're all going to be that great stars in the galaxy of achievement, right? And going to give me a good news that you cleared the step 1, step 2, FMGE, NEET PG with 99 percentile score. I'll be waiting here to proudly receive that news. But every day, make it a point to log into the YouTube channel. Anywhere, anytime, accessible, affordable. That is the buzzword of onlinembbs.com video library. So doctor, 56-year-old obese man, severe excruciating pain. Oh my God, doctor, save me, doctor. My left toe, doctor. Oh my God, I can't bear this pain, doctor. You are the young person who started your clinic. Looking at that lesion, you realized even without doing any investigation, you opened the mouth of the patient, put an indomethacin tablet. Wow, what a relief, doctor. You are a God doctor. And the patient will bring another 20 patients. His entire family he will bring for you. So that is the reason sometimes to be successful in clinical practice, you should be lucky enough to get cases like hypokalemic periodic paralysis. Hypokalemic periodic paralysis, very dramatic. The villagers bring a case, all the 4 limbs paralyzed. Young man, they will say, please save God. You are the God doctor, they will say. You just took the serum sample, get the potassium done, you found that there is a hypokalemia. 40 milliequivalents KCl, potassium into a 100 ml saline, and then slowly you ran the infusion. The man's right hand raised, left hand raised, left foot raised, right foot raised. He will wake up without paying your hospital bill, he will run away. No problem. But he will make you popular. You will become Rajnikant in that entire village. So doctor, there are certain conditions where history is the thumb, doctor. With the history, you should be able to make 90% of your diagnosis. So always remember, big toe, excruciating pain, unless proven otherwise, gout. So everything else is a game. This is a negatively birefringent crystals of the urate. But this guy is allergic to NSAIDs. That's the reason the alternative is colchicine. Why colchicine? Because colchicine inhibits the microtubule polymerization by binding to tubulin. And that inhibits the immune cells' motility and activity. So this intensely inflammatory joint of the gout, you have to stop the macrophages, WBCs from reaching the site. So you have to create a social distancing. That is what colchicine will do. Colchicine will paralyze, will make social distancing, lockdown of the inflammatory cells and clear the inflammation from the joint. That's what you need to remember. A 26-year-old woman develops a erythematous, finely punctate, blanchable rash. The rash developed first on the trunk and the neck, and within a day to the extremities, but it is sparing the face. So what is this called? Sandpaper. It is so fine that it looks like a sandpaper rash is the name given. And what is this tongue called? Strawberry. Strawberry tongue is what you need to remember, which is classical of scarlet fever. Scarlet fever is caused by Streptococcus pyogenes, sandpaper rash, strawberry tongue, beefy red pharynx, circumoral pallor. That makes the scarlet fever. Scarlet fever. There is a very nice movie, Nanny McAfee. You have seen the movie Nanny McAfee? I have seen the Nanny McAfee first version. Emma Thompson, very good acting. And Nanny McAfee part 2, Returns also is a very good one. So my kids are all waiting. Hey Dad, today we will watch Nanny McAfee Returns on the Netflix. I said that, okay, instead of 50 questions today, I'll discuss 25 questions with all my students. And then be ready. I'll be joining you to watch the Nanny McAfee part 2, right? So, now doctor. So, make this next 10 days of lockdown, take a time to spend with your little brother, with your brother's children, with your elderly father. Talk to him how he started life, how he fell in love with your mom, and what made him challenged in his life. Spend a good time with the family, and if your environment permits, have a little evening stroll, watch the sunset. There are many beautiful things in life than always chasing behind a busy schedule, right, doctor? So please take that, everything in that positive spirit. So 16-year-old football player fell down on the ground playing the football game. So tomorrow our Honorable Prime Minister said, let us switch down all the lights and then light a candle. It's a good thing, you know. In any war, 1.3 billion people in a nation like us are being incarcerated in our homes. In any war, having a high spirit is most important, doctor. So either doing clapping or 9 minutes of lighting a candle is all to increase that morale, tempo. Otherwise, we are all suffering from a kind of a depression that when will this COVID will end, when will the life will restart, etc., etc. So honestly, there is nothing to feel towards that negative limbo, but we need to become incredibly positive minded. Even preparation for exams also is all about being positive. If you are shivering about what is going to be the result, will I pass this exam or not, you will fizzle out. But rather you feel, I'm being born to become that great surgeon. I'm being born to become that great cardiothoracic surgeon, cardiologist, save thousands of people. Then automatically you will read, automatically you will study, because you are born for that. God created you for that purpose. So that is the spirit with which we need to move forward, doctor. So this 16-year-old, when he fell down, he tries to stand up, the right leg buckles. Then when he is being brought to hospital, the tibia is moving easily That's called drawer test, anterior drawer test. Excessive gliding anteriorly is there. So what have you seen on the MRI doctor? Typically you are able to see medial meniscus injury and also anterior cruciate ligament injury. So you should know the ACL is one of the 4 major ligaments of the knee that bridges the femur and tibia. So what is called the unhappy triad? Whenever there is any kind of a twisting, sudden twisting of the foot, ACL, medial collateral ligament, medial meniscus, all the 3 become involved in the injury. In the common knee injuries is what you need to remember. Now, doctor, a 64-year-old man presents with limp. He's having that since childhood. Whenever he walks, the patient takes a step with his right leg, then leans all the way over to his right so that he can swing his left leg to take a step. What is that called? Trendelenburg gait. It's called Trendelenburg gait. So very simple, doctor. Let us say this is your pelvis. This is your pelvis, right? So you have a limb this side, this side. Then your gluteus medius and minimus. What is their main function? Whenever you lift this leg, then all this weight will try to make the pelvis tilt down. You lift this leg, this side leg, for example, then all the weight will be the pelvis on this side. When the leg is lifted, if the foot is lifted from the ground, will try to sink the pelvis to that side. But what will the gluteal muscles on this side will do? They act like a pulley and pull it up so that it rises up back. But if there is any weakness on this side gluteals, then the opposite side, whenever you lift the foot, the pelvis will sink down by the pull of the gravity. That leads to a duckling gait, which is called Trendelenburg's gait, is what you need to remember. So it is the gluteus medius and minimus which act like a pulley to prevent the sinking, is what you need to remember. A 12-year-old boy complains of the pain on the right femur. There is a firm, immobile, tender mass for the past 2 to 3 weeks. The pain is worse in the night. And you have done the histology. What you can see, doctor? Blue colored cells present in the form of a rosette. So this is the classical appearance of Ewing sarcoma. And where is the tumor? Typically, the tumor is in the shaft of the femur. Shaft means diaphysis. So there are only very few tumors which are diaphysial. Ewing sarcoma is a classical diaphysial tumor. So typically diaphysial tumor, Ewing sarcoma, what type of mutation do you see? T1122, chromosomal translocation is what you classically see. So Homer-Rit rosettes and S100 protein antibody positivity, they're all the things that points towards the Ewing's T1122 translocation is something that you need to remember. A 32-year-old man develops acute onset of fever, malaise, muscle pain, hypertension, abdominal pain, bloody stool, pre-renal failure after recovering from hepatitis B infection. Fever, malaise, muscle pain, hypertension, abdominal pain, bloody stool. How can you explain all this together? Unless there is some disseminated infection. The other possibility is vasculitis. So what is this entity, doctor? You can see the aneurysmal dilatation of the vessels along with the stenosis. So it is a case of polyarteritis nodosa, that beaded appearance and all those aneurysms. So this lead to vasculitis. And polyarteritis nodosa, when it lead to vasculitis, it involves the mesenteric vessels. And mesenteric vasculitis lead to mesenteric vascular ischemia, which lead to development of abdominal pain as a clinical presenting feature. It also lead to hypertension because renal artery is involved. 30% of cases of polyarteritis nodosa are associated with hepatitis B seropositivity, is what you need to remember. Which type of hernia? The hernial sac protrudes from the abdominal wall superior to the inguinal ligament and medial to the inferior epigastric vessel. So inguinal hernias are of two kinds: direct, indirect. Indirect means, all of you know, there is an inguinal canal. Through that, if it passes, it's called indirect. Direct means if there is any abdominal wall weakness, through that if it comes out, that is called direct. So it comes through something called Hasselbalch's triangle. Through that, the direct inguinal hernia will come out because the abdominal wall weakness in elderly person. Typically direct inguinal hernias are all elderly. Whereas passing through the inguinal canal typically as a herniation occur because of a congenital defect. So that happens more in the younger individuals. So that is the reason this is an example of direct inguinal hernia, is what you need to remember. A biopsy of one of the several red tender subcutaneous nodules on the anterior lower leg. What is this called, doctor? Erythema nodosum. So what is erythema nodosum histopathologically? It is also paniculitis. Erythema nodosum is paniculitis. There is an inflammation of the fat, which is called paniculitis. There are many reasons for erythema nodosum, but in this case, the patient is also having, what is the most common reason for that? Crohn's disease. So inflammatory bowel disease can lead to development of paniculitis, which is called erythema nodosum, is what you need to remember. Now, doctor, which muscle may be affected if somebody tries a little heroic wrist slashing for suicide on the medial aspect of the arm? So medial aspect of the arm is all the territory of ulnar nerve. So you should know what are all the muscles innervated by the ulnar nerve. Hypothenar muscles, third and fourth lumbricals, and all interossei, dorsal and palmar interossei. Then adductor pollicis. Pollex is on the radial side, but the only muscle of the pollex, the thumb, which is innervated by ulnar nerve, is instead of median nerve, is the adductor pollicis, which is the branch of the, supplied by the branch of the ulnar nerve, is what you need to remember. A 14-year-old girl presents with the complaints of fever, malaise, pain in her left forearm, high temperature, very erythematous, warm, tender on palpation. So that's all pointing towards osteomyelitis. And what do you see, doctor? In her peripheral smear, sickle cells is what you're able to see. Now the question is simple. Osteomyelitis in sickle cell anemia most commonly is Salmonella species, is what you need to remember. So these are all very standard questions, doctor. Let me tell you. USMLE step 1. Anat, physio, biochem, micro, pharma, patho, behavioral science, which is like psychiatry. Then step 2, medicine, surgery, gynecology, obstetrics, pediatrics, dermatology, radiology, family medicine, and biostatistics, etc. So we plan to finish 5,000 MCQs in step 1 and 5,000 in step 2 CK, clinical knowledge. We take about next 4 months, around 120 days. And the moment you finished participating in this 10,000 question bank discussion, you're ready to face any licensing exam, doctor. Already the single liners and quick topic-wise review, everything is available in the onlinembbs.com video library. Once more, thank you for participating. Please don't forget, onlinembbs.com is your friend, a true friend which is going to be there with you, and take it a responsibility to see that each one of you until the last row clear their exams in flying colors. We just not give only video, but we will hold your hand every day to study every day like your classmate. Thank you very much. Once more tomorrow we will all join for the broadcast. Good night.